Hi, everybody. Welcome back to another episode of the NDBI Navigator Narratives, this conversational style podcast where we get to talk to influential researchers and community practitioners who are working so hard to disseminate and help implement NDBIs in and around the world. And I am excited to introduce you all to Dr. Bonnie McBride, who is a BCBAD level practitioner who is the professor of developmental and behavioral pediatrics at the University of Oklahoma Health Campus and the director of the Oklahoma Autism Center. And Bonnie, I wrote that all down because that is a lot of really impressive credentials.
Well, it's more, yeah,
Welcome.
sounds important, but
It is important. Thank you for joining us today.
thank you for inviting me. I look forward to our conversation.
Me too. I would love to let the listeners know a little bit more about your incredible journey and what you've been on to be an NDBI practitioner and how you ended up where you're at now in Oklahoma.
Okay. Well, first, just to mention one of my big affiliations is with Project Data, developmentally appropriate treatment for autism, which I worked with Dr. Eileen Schwartz, who was my mentor for many years, and she and I and others developed the model. So that's obviously a huge influence. I think I was thinking about this question because for me, and this is going to age me, but NDBI, I mean, it's really, I've always practiced that way because in my early training, I was influenced by a lot of researchers in early childhood special education field or early intervention. So these are, and I would say, gosh, a good majority of them were behavior analysts by training. So people like Phil Strain
Yeah.
and Mark Woolery and Sam Odom and Scott McConnell, Mary McAvoy, Steve Warren and Ann Warren, Ann Kaiser, of course,
Mhm.
Gail McGee. So some of them are authors of that article that defined NDBI as kind of an official term. So for me, it was really just that was, and I think if you look at like the Division for Early Childhood,
Yep.
those are recommended practices.
Yep.
You know,
Yep.
all of the things we talk about when we talk about what makes something a NDBI intervention or approach. So it was really natural for me to kind of, and I like the way they conceptualized it.
Yeah.
So I think that's helpful to have, something to call it. Um, and I think so for me, it was very natural. It's the way I've always been trained to practice. It's always how I've practiced. And I
Lucky.
think, yeah. And so, yes. And so I guess the best compliments I had with one of my former mentees, but now a colleague, we had somebody come to Oklahoma because of course there's lots of ABA clinics set up here now,
Okay.
as there are in other states, I think. And so we had someone come and do a talk about basically naturalistic behavior. I mean, I don't think it may have been before
The term came
they
out.
had, yeah, before they coined that term or around there. But
Mhm.
anyway, to talk about those interventions. And so one of my mentees, she turned to me and she said, "This isn't new. This is how we've always done it." And I'm like, well, true, but it is new to some people.
Yes.
Unfortunately, yeah. So, fortunately, fortunately, but I think that, so that's where really my big influences have
Yeah.
emerged from. And all of those researchers influenced me a great deal. And of course, Eileen Schwartz, who is my mentor, the University of Washington, which is where I did my doctoral work.
Yeah.
And she was a great mentor. She
Yeah.
introduced me to people and I went to conferences with her and we did research together. So I had a lot of great opportunities with her. And she was always very generous that way. So I feel lucky
Yeah.
to have that mentor or mentoring.
Yes.
As far as Project Data, of course, it has those influences,
Yep.
and although I will say I think Project Data probably has a little bit more traditional instruction so like when I say that, discrete trial training.
Okay.
I mean, that's always kind of what's that's what's often juxtaposed
Mhm.
against NDBI. But I've always, for me, it's like, well, I think it's really about how we put together those different components,
Yeah.
right? Because
Yeah.
naturalistic strategies also could be discrete trials because
Sure.
you got to have a stimulus that you're going to respond to, and then you're going to
Yeah.
reinforce it or whatever. So
Yeah.
you're going to have all those components. If you're going to prompt, it's got to be before or as the child responds. So there's important pieces to I think discrete trial as a format. Now, I think what's happened is, of course, it gets associated with mass trials,
Correct.
decontextualized reinforcement, all
Mhm.
of those things. Now, I will say sometimes I think discrete trials are necessary. We built it into our
Yep.
program for certain, there are certain skills that children will never initiate to learn. It's like you gotta get him into, you gotta, lead them there and
Yes. Yeah.
kind of set up that some of those contingencies so they learn how to
Mhm.
respond to contingencies or to respond to requests from adults or from their peers. So I think those are, it's important. Initiation, responding is just as important as
Yeah.
learning to initiate. They're both,
Yeah.
especially when you're little.
Yeah.
So both need to happen. So, and I don't think there's anything, I mean, I think all of the models that use NDBI as their, I mean, I would agree, I would assume.
Mhm.
And they use both too. So, or not, maybe not discrete trial, but they use that
Pre-trained
framework.
vintage. Yeah.
Yes, they use that
Absolutely.
framework and they talk about how to deliver reinforcement effectively and, how to make sure you're not teaching kids to respond to the wrong cues,
Yeah.
because we know children with autism often aren't they're not discriminating the cue that we want them to respond to. So we have to, sometimes be really explicit about that.
Yeah.
I do think there are times when, you know, lots of practice on a skill is useful.
Yeah.
They learn it more quickly.
Okay.
Now, you have the downside, right? You gotta generalize. You gotta work harder to
Yeah.
generalize the skill, and you want to make sure you're maintaining it over time. So I think there, as everyone's pointed out that talks about NDBIs, is there's really you're making a lot of decisions just like you would if you were doing discrete trials.
Yeah.
So and I think that the distinction that's made about, being more focused on child motivation, that's
Mm.
important. But I would hope that if you're doing discrete trials, that you're also
Correct.
using child motivation
Yeah.
to engage that child in learning. I mean, otherwise, it's not really probably going to result in the outcome that you want, right?
Yeah.
So the other thing I'll say too is one of the experiences I've had is I think discrete trial, that more traditional, I'm calling it traditional, but
Uh-huh.
that approach is not just useful for children sometimes, but it's useful for adults that are learning to do this intervention.
Yeah.
And I think one of the things that and Eileen and I have talked about this a lot over the years, is it's really, you read the article, the NDBI article, the
Uh-huh.
2015 year, it's like, wow, this sounds great and everything, you're synchronizing but it's like, what does that look like?
In
How do you
practice.
teach someone to do that who
Yeah.
has no experience, because if you look at the way that our service structure is set up now
Yeah.
is you've got, registered behavior technicians who are delivering the intervention. It's more of, which I think is, it can be an efficient way to do it. But you have people coming in that have no, they're learning from square one.
Yeah.
I think the fact that our work has been a lot in education settings. So
Mhm.
we've worked a lot in public schools. We've worked a lot with Head Start. Recently, I've been working a lot with childcare
Oh, wow.
centers because, so that they can keep kids on the autism spectrum in
Okay.
childcare. So, because that's such a big issue for families.
Yes.
So if you're looking at those contexts look different than a clinic-based intervention, obviously. So I think that's more my orientation, and
Yeah.
where I've worked more is in those education settings.
I would love
Um,
to learn more about the childcare. That's an incredible, I feel
mhm,
like, extension of a kid can get some incredible work done and support in a
mhm,
clinic setting. But then if that child can't go to daycare or they don't accommodate
mhm,
or accept, then that is another
right.
burden or
Mhm,
barrier to a
mhm,
family. And that would be incredible. I don't know of any providers that are
yes.
going into daycares and doing anything from a systems lens.
Mhm.
Can you talk more about that? What you guys
Well,
are
we're just starting, but and I think that if I remember correctly, I think like Aubin Stammer, who I've loved her work as well, and I think she's done some work in childcare settings as
okay.
too, with her model, which of course I'm forgetting children. Oh gosh, I
This
can't remember what it's called. Oh, I hate that. Anyway,
we'll Google it.
she has a model,
Okay.
an early intervention model. But I think she has done some work, and I do believe that I've read some work by, using like Early Start Denver model in child care centers or child care environments.
Okay.
So anyway, so I think it's one of the things I found is that a way to enter the world of intervention for adults, is through learning how to do just basic instruction, because you can give them all the theoretical background and you can go through what this means, and it's just like blah blah blah. I mean, they're not understanding any of it yet,
Nope.
because
No.
they're just they're just starting to have a grasp of these concepts. And so
Hmm.
to be able to then take that and put it into what it actually looks like interacting with a child is a big leap, I think. And I think we know that when you look at, just workshops in general don't change practice as much as we would like them to. Um, so that's where I think we found that it's a way to enter that world of intervention, or how do you have an instructional interaction with a child? How do you know, make it fun? How do you set up the environment? I mean, in the childcare centers we're working, it's just like things like having fun materials on
Yeah.
the table or on the shelves, or just that basic level, like how you can adjust the environment to make it more
Hmm.
motivating. And I think one of the childcare centers we worked with, and I guess a lot of times the children that are in their centers haven't been diagnosed yet.
Yeah. Okay.
But the issue is more, there's challenging behavior, and
Hmm.
that's usually what exits them from programs,
Yeah.
childcare programs. So we are kind of coming in from that lens, is,
Yeah.
okay, this child's struggling with some behaviors that we don't know how to address. And so we can come in and just talk about,
Yeah.
motivation. And so it's really some basic
Like
stuff.
classroom
Yeah,
wide.
right.
Okay.
Classroom-wide individual interactions, maybe how you might set up. And again, it's really not so much around intervention, it's around being able to be successful in that environment. And of course, learning is part of that, but we're not doing maybe structured lessons
Right.
around the
Yeah.
areas that we would work on if they were, let's say, at Early Foundations, which is our early intervention program in Oklahoma. Um,
And before we
so that's
started
been fun.
recording, oh, sorry. Oh, sorry. Before we
Oh, go
started
ahead.
recording, you had mentioned that Early Foundations, which is your early intervention site, was on
Hmm.
campus and in the community for
Yes.
reasons like this. Is
Hmm. Yes.
that
Right.
correct?
Exactly. Reasons like this. And I don't know, I'm actually not sure if this is true or not, but when I came from Seattle to Oklahoma, and I came here because, well, there was a position, but also my husband wanted to live here because he had some career work connections.
Okay.
So we came here for that reason, but we also came because there was a position in the Department of Pediatrics, and the section chief, or the chair of that department, was really wanted somebody that had intervention background to really have some impact on interventions, treatments, being able to help from that side, as opposed to, they had people who could do diagnostic evaluations, but they wanted to have people who also knew how to intervene and help kids and families. So he brought me in for that primary reason. But when I got here, there was on every corner, there are a lot of churches, as you might think, in
I
Oklahoma.
can relate. Yes, ma'am.
Yeah. And they have these they call them Mother's Day Out programs. So I don't know how common they are in other states, but they were
Yeah.
they were everywhere here. And so they're not full-time childcare. It's usually like 9 to 2.
Yeah.
But parents can drop their kids off. They can go 2 days a week, 3 days a week. It's very, there's a lot of there's more flexibility, I
Mm.
guess. But you don't have certified teachers. You don't have people that necessarily have a lot of background in young children. So it varies a lot, I think, in terms of what the kids are, accessing. But
Yeah.
it's usually play. They just toys that the kids play. They have a nap, they eat snack or
Yeah.
lunch or whatever, that kind of thing. So I thought, okay, well, we needed a space,
Yeah.
and we also would, an important component of the project data model, which is what we were implementing, was the, regular, consistent access to peers.
Mhm.
So that, for multiple reasons, generalization, socialization, all of
Mhm.
those things. And so the Mother's Day Out program model fit perfectly because, kids aren't there every day together. So it wouldn't be unusual for the children on the
Mhm.
spectrum to only be there 2 days a week, because there were other kids that were also in playgroup 2 days a week. So that doesn't create a situation where you have this kid that just comes and goes.
Mm.
And are they really a member of the classroom?
Yeah.
Maybe not, probably not seen as that. But so in this case, because we were able to structure our programs, we have Monday, Wednesdays, and Fridays. We have more sessions where we're doing more, I'd say, a combination of traditional and NDBI interventions,
Okay.
for a 20 to 30 minute time period. Because, you got these little toddlers.
They
And
get busy.
so, and they get taught. And so then we transition to a child-centered, like introducing things like outdoor play and
Oh,
snack time and,
perfect.
free play, because that's
Mhm.
also something they need to know how to do. And so our rooms are set up pretty much like a classroom. If you were to
Okay.
walk in, you would think this looks like a classroom. Um, so the Mother's Day Out, the kids go in on Tuesdays and Thursdays to their Mother's Day Out program, and all the kids come in together. They come in together. They do all the activities together, and then we do have additional trained staff that are there to support the children on the autism spectrum. Um, I think one of the other things that I think is really unique about the way we've implemented early foundations is that we've worked with our state early intervention system. So
Nice.
that's our Part C
Yep.
services.
Yep.
And here, of course, it's Sooner Start. Everything is sooner something for the Sooner State.
Yeah.
And so Sooner Start is our state's early intervention system. So I've had a great very long standing collaboration with our Sooner Start intervention system. And so that's how kids get access to the program, is through Sooner Start. We
And
do
that's
not
early.
require, right, because they have to have qualified for services
Got it.
through their Part C. And then the clinicians who are seeing the child, they kind of decide who they would like to refer to
Okay.
receive these more intensive services. And of course, the parents, agree. They have to provide their own transportation, so that can be tricky for some families. So it's not a perfect setup for sure. But I think the upside of that is we do not require a diagnosis, because I don't know, in our state, like it can be up to a
Oh,
year to
yes, ma'am.
get a diagnosis. And when you're talking to, these young ages, that's a long time, a lot of
Yes.
missed
Yeah.
opportunity.
Yeah. I can
So,
imagine.
and so we're not billing insurance. So we are able to offer it to kids who do not have a diagnosis. They just need to screen at risk,
Okay.
and then qualify for services through Part C, which has their own
Certainly.
requirements in terms of delays, et cetera.
Yeah.
So I think that's it to me, that is a plus because it gives kids access to these services without having to wait and to get a diagnosis and then go through that whole process.
Yeah. And then having it
Um,
in the community gives parents
mhm,
easier access to, like you said, you mentioned earlier about going to the university and parking, just
mhm.
access to
Yeah,
getting
yeah,
places. It just puts it in the neighborhood where they might live or reside. And so I
right,
feel like there's
right.
access kind of going both
Hmm.
ways,
Hmm.
limited, removing the barrier to access for a diagnosis because you
Hmm.
don't require that. And then also being in a community setting where families,
Hmm.
if they have to travel, maybe it's not as far to the university because there is a local Mother's Day Out
Yeah,
program closer
yeah.
to them.
Yes,
I love
exactly. And the kids that we recruit, or the kids who are enrolled in the Mother's Day Out program, come from that community around where we're located. So again, there's always that pull to be like, okay, we're going to open the autism. We have an autism center, although we're not really a physical building, um, because we do work in the communities a lot. But um, it's always everybody wants you to have a place, and everybody comes to this
brick
place.
and
All the
mortar.
kids come.
Yeah.
Yeah, brick and mortar building, and
Yeah.
all the kids with autism are going to come here. Well, that just isn't. I don't think it's good practice, but it's not realistic either. So what we do have 5 early foundation sites that are located around the state. Of course, they're all clustered in the metro,
Okay.
in the metro areas.
Not so much rural.
Unfortunately, there's challenges for more rural parts of the state. That's a whole other conversation. But so in these metro areas, we've got, them in like 5 different counties. And we're not serving large numbers of kids because we've got space. We have space
Yep.
challenges. We've got, of course, cost and all of that. So there are some, again, it's not a perfect system, but it's worked well for a lot of the families that have come through this program over the years. So we've been here about 18 years.
Okay.
And so, yeah, so
2006. Is that when you went to Oklahoma,
I
2012?
moved, yep, 2006, exactly. Good memory. Yep, I came here in 2006. I just 20 years, celebrated my 20 years this month or last month. I know.
That's
I don't know
great.
if that's a clapping or but
Clapping.
but
Yes.
no, I've had lots of great opportunities here because, there's there is something to be said for being in a place that, has great, oops, sorry,
Mhm. Yeah.
has great needs because you have more opportunities to then create programs and all of that, have that
Yeah.
influence.
You can be really
Um,
innovative with that. And I think that innovation would be welcome there, as opposed to pushing up
mhm,
against an established
yes, right.
system that might not be working, but that's how it's always
Mhm,
been done. So that
right.
gives you a little bit of
Mhm,
an edge.
mhm. Absolutely. And I think, some more flexibility in that way. So that's, the downside is, we don't have as many colleagues that you would have if you were on the West Coast or the East Coast, as we've talked about, who, where all of the people are located that,
Yeah.
have all the research
Yeah.
dollars and the great programs.
Beaches,
So,
coastlines.
right, right. So,
But the
so
Midwest is
anyway,
great. You all listening should come here, look for jobs and move.
I
How did I
agree.
all
I
be
mean,
on an
there's,
island all by yourself?
and you have lots of, you just have to be more intentional about those collaborations and reaching out to people. So that's worked well. So I think, and this was in Oklahoma, this was the framework we used for the um, clinical trials we did of Project Data, which
Okay.
um, we we had some participants that were in Seattle and some that were in Oklahoma. So um, just looking at outcomes, and we did have a non-data group. So we can't say they didn't have any intervention because they were all in state services, state sponsored
Hmm.
services.
Hmm.
So yeah, so that's, that was the the context that we did the work here in Oklahoma. Um,
Do you guys ever,
so,
oh, sorry.
oh, go ahead.
Do you guys ever have anyone reach out for consultation? Like, say there was somebody listening who
Mhm,
said, "Oh my God, that sounds amazing. I live in a place where
mhm,
there's not a lot of resources, or it's real far to
Hmm.
get to a center, or I would really like my child to be
Hmm.
in the community and they
Hmm.
wanted to replicate or
Hmm.
extend what you have created. Is that something people ever reach out to learn how you've done that to then try to, or have support
Hmm.
from you all for how to
Hmm.
replicate that there or different countries? I'm trying to think.
Right. Well, I have to say a lot of those requests go to the University of Washington.
Mm-hmm.
So Eileen,
Okay.
and she has a group of people there that
Okay.
have, supported replicating the project data model. So, I mean, it's not that I'm not open to it. I just think that people, I've done that locally. Like there's quite a few of our school districts in the area who, I will say I'm very proud the fact that they've all, not all of them, several of the big districts have implemented an inclusive classroom model that's similar to the way Project Data is set up. So you have pre-K kids, and then you have up to 5 kids on IEPs. Now, I
Okay.
actually like the way the districts are implementing the model even a little bit better
Oh,
than data, because data was just focused on kids with autism, right?
okay.
Well, certainly any child with a developmental delay or disability is going to benefit from NDBI strategies or good practice. And so I think so that was so they have implemented the kind of the structure of
Mm,
Project Data. So they've got the combined, kids. So it's a smaller class.
okay.
And then typically, I don't. We have universal pre-K here, which is,
Yep.
one of the well, maybe one of the things we can say where we have in Oklahoma that's, advanced in the area of education. But so we do have universal pre-K. So all districts have some pre-K.
Okay.
And a lot of the bigger districts are offering pre-K full day now. So the kids are
Oh,
there, full day.
wow.
And so that's a great opportunity, I think, for a lot of kids to be somewhere, um, you know, learning and getting ready for,
Mhm.
going to school. So
Yeah.
they're, so because we have that structure already in place, it was easy to kind of combine a autism special education or just developmental delay
Yeah.
classroom is what they call them here, with a typical pre-K classroom. And just, now you've got, I mean, 10 kids is the maximum they're supposed to have
Okay.
in like a 3-year-old program. But oftentimes, it goes above that sometimes,
Okay.
unfortunately. But anyway, that's the basic, so 10, and then you've got 20 kids who are in pre-K, and then we put them together, and then we have 15 and 15.
Okay.
And then, one's taught by the special education teacher, and one's taught by the pre-K teacher.
Okay.
And then you have support staff in both of those rooms. And
Yep.
so that's really been, I mean, they've done these districts have implemented this model. I think
That's
it's,
awesome.
really great, and has been it's been real successful. Now, there's, again, it's not perfect. There's not all kids have access to it, because there's sort of a little bit of a prerequisite, which
Okay.
in my mind is a little bit of the downside of NDBI, because theoretically it shouldn't matter what the child's skill level is. They should, NDBIs can work with any
Hmm.
child at any skill level. However, I think when they're being implemented in a classroom setting, and you have a child that has high needs,
Yep.
and need a lot of support
Yeah.
for learning, it's not it's hard, I think, to get that focused instruction done.
Yeah.
And I can relate to that, because you get to the end of the day and you're like, you have this whole plan. Okay, I'm going to give like 5 opportunities to
Yeah.
request, blah, blah, blah. And then all of a sudden, Bobby is climbing the bookshelf over here. So
The filing
it's like,
cabinet.
forget
Yep.
it. I got to go get Bobby, So,
Yeah.
there's disruptions and there's things that happen. And so it's sometimes hard. You get to the end of the day and you're like, ooh, I didn't really teach that much, or at least the things that I wanted to teach didn't get done.
Yeah.
So that's why we decided to do that blend, where we have our 3 days a week that are kind of more one-on-one, and then 2 days a week in the classroom. So
Yeah, and I wrote
That's my
down
spiel
something.
on that.
Yes, yeah, I wrote down something you had said,
Mhm,
instructional interaction with the child, and I love
mhm,
that. I feel like that's a great way for people to understand. I feel like you could interpret that a couple of different ways.
mhm.
One of the things I always kind of hear with NDBI, oh, you're just playing. Oh my gosh, no. Do you know how hard we're working to make it look so
Yes.
naturalistic, but and
Yeah.
present and productive at the same time? And for me,
Mm-hmm.
that instructional interaction with the child you
Mm-hmm.
mentioned, it's part of that productivity of
Mm-hmm.
here and we're teaching, whether it's contextualized or not, or natural or
Mm-hmm.
right, we're
Mm-hmm.
kind of trying to find that balance of everything.
Mm-hmm.
I think some people kind of
Absolutely.
overlook sometimes of no,
Mm-hmm.
we have aims and goals and data.
Mm-hmm. Mm-hmm.
We're trying to figure
Yes.
out the best way to
Mm-hmm.
do it, which
Mm-hmm.
kind of goes back to being aligned in those community settings with the,
Mm-hmm.
EC recommended practice that you talked about a few minutes ago about,
Yeah.
the importance of that and how well
Mm-hmm.
that just kind of aligns for
Mm-hmm.
NDBIs, especially in the school settings or community settings
Mm-hmm.
that you're in. I
Yeah, I
love
mean, you have a natural set structure, but again,
that.
there's all the challenges we talked about. And
Yep.
I think, I think, one of the not criticisms, but concerns that I've heard from, practitioners in more school-based settings or early intervention is, some of the NDBI models they say they're too complex.
Mm,
Like there's a book this big and it's got
yeah.
all this text and people aren't going to read it all, and
Mm.
how do we get everybody trained, and so all of the things that we know are challenges for any new, when you're learning something new as an adult. But I do think that I do think we got to figure out a way to make these interventions accessible
Yeah.
to people that are with kids every day, because we know how to do this. It's not, you look at the research, like there's some new studies that come out, and maybe a different, a little better way to teach joint attention or
Yeah.
whatever. But basically a lot of these interventions that we're using and that we talk about have been
Rinse and
studied. I mean,
repeat.
we know they work. They work
Yeah.
really well. And then how do we get
Them to
those
work into.
interventions, yeah,
Uh-huh.
in the hands of the people who are interacting with the kids? And
Yeah.
so I think that's our challenge. So my interests
Yeah.
kind of moving forward are really around that kind of implementation science aspect of how do we get these these, research supported, you know, uh, procedures into, how do we get them into the hands of, or the knowledge base of, whether it's teachers or clinicians. I mean, I will say, there are BCBAs that don't get training in NDBIs in Oklahoma. I don't know about other states, but
Mhm.
they may not get that training. They may
No.
get, much more of a traditional,
Yeah.
kind of more clinic, kind of sterile environment. The child walks in and there's a table and a chair, and hopefully we're getting away from that. But I still think that's out there still.
Yeah,
So,
and I really appreciate and I'm super envious of your incredible mentors and
mm,
people that you've had the great privilege of learning from that developmental background, or I
mhm,
kind of circle back to
mhm,
again the DEC and kind of everything
mhm,
about your entry into this kind of world and how it's just always been that way. And for me, that was not the experience. I didn't have
mhm,
that background. I didn't really get into it until I got into
mhm,
NDIs, and then the
mhm,
light bulbs just started
mhm.
blinking of if we are supporting young children, why do we not get trained on like that should be like
Yes.
developmentally
Okay.
appropriate practice
Hmm.
need
Hmm.
to know these guidelines. And
Hmm.
yes, it might be outside the field, but
Hmm.
again, it's specific to the population you're
Hmm.
servicing. You need to know as a
Exactly.
specialty.
Hmm.
And
Yeah.
I don't think that is
Hmm.
really trained or coached unless you have somebody
Hmm.
who brings that to you. I think that's
Hmm.
a huge thing that we need to
Absolutely.
work on in our field.
Hmm. Yeah, absolutely. And it does, and it's not, so I'm really interested in, like, how can we create, I don't know if it's going to be a training package. I mean, we have our own, um, model we use here, and also
Okay.
project data, where it's, there is some, the kind of behavioral skills training, which we know works well in that, behavioral environment, but also How do you bring in the child development? How do you bring in, like, what do little kids like to do? You kind of need to know that if you're
Should
working
they
with
be
little
doing?
kids. Yeah, that's right. You got to know how to change a diaper. There's some just like practical things.
Mm,
So I think those things, those,
mm,
understanding like the context in which neurotypical toddlers are learning is really important to know that. You may not be able to always use that context with all kids that need support on the autism spectrum because, they're not learning, they're struggling and learning in those kind of typical environments or they wouldn't have been identified, right? So I think that it's important, that's obviously you have to, adjust and meet the individual needs of the kids, but you also have to know this other piece of it.
yeah.
Exactly. And I think, kids get older and that's
Yes.
a whole other discussion. Like what,
Conversation.
then you don't want to be developmentally appropriate because then you have people saying, oh, he's functioning at an 18-month-old level. So, well, he's not, you're not going to
Generalizing.
do 18-month-old things with this 6-year-old.
Correct.
So anyway, that's a whole
That's a
other
whole nother
topic, but
podcast
a
episode.
whole other ball of wax, you might say. So,
Yeah, but amazing.
anyway, but
Yeah.
so I'm definitely interested in that implementation piece. And I really am working on, um, a follow-up for
Ooh,
some of our kids that have been in both in Seattle and Oklahoma in the project data model. And I mean, long-term follow-up. So like they're now like this cohort we had of kids that we, collected data. Um, they're in elementary school now because it was a while ago. So, but here's
the
one of the
growth.
things, like one of the things we've learned from the data that they've analyzed from pre-K in Oklahoma, because they've actually used Oklahoma a lot to look at,
Okay.
outcomes for kids who are in pre-K versus those who aren't. But, you do see some immediate effects for sure,
Okay.
differences. But really, when they're seeing more powerful outcomes later on down the line. So,
Wow.
health benefits. They're more likely to, go to college. They're more likely. So you may not see like, oh, their, IQ score, went up this much. Um, because of this intervention, it's really about like these kind of downstream
Yep. Yep.
benefits of being able to get these foundational skills that we're teaching young kids.
Yep.
And so I just think, I think it puts them on a different trajectory, gives
Yep.
them opportunities and access to things that they may not have had if they hadn't learned those things.
Yeah.
So
And I think
that's
that's
my
such an important discussion and
hypothesis. Hmm.
sticking point for practitioners who are
Hmm.
programming. Are you working on the right
Yes.
thing at the right time and the right setting that's
Hmm.
socially valid and meaningful for the children
Hmm.
at whatever chronological or developmental age? And are you
Right.
making it all
Hmm.
matrix
Hmm.
together somehow for
Right.
cascading
Hmm.
downward
Hmm.
stream kind of effects? So what are we looking at? This is going to
Hmm.
open the door to this. This is going to set them up for
Hmm.
think about preschool kindergarten readiness. Like,
Hmm.
yay, if you know your
Hmm.
ABC one, two, threes, but how about executive functioning, emotional regulation,
Right. Right.
tolerating being
Hmm.
around others, playing with
Hmm.
others, sharing like
Hmm.
those social emotional skills that are really
Yes,
make or break for the behaviors, not the academic. So
absolutely.
really
That's the
working on
academics. I have not in my whatever 20 or actually longer than that, many years, I want to say experience. I've never heard of a kid getting asked to leave pre-K because he doesn't know his ABCs.
correct.
But you definitely hear, oh, he's not potty trained, or he can't, he has, challenging behaviors because he doesn't have a communication system. That's you kind of need that, so those are the things that those missing those skills are what keeps kids out of typical environments
And that goes
from
back to
my experience.
the
Hmm.
access that you're talking about.
Yeah.
Access.
Hmm.
Uh,
Getting access. And so I'm real curious. I mean, I have a lot of anecdotal
okay.
evidence, but I'd really like, just, parents reporting back, their child is now fully included in general education. Now, it's not 100% of the kids. I'd say about half of the kids. So
Mhm.
it's about the same kinds of numbers that you see in other intensive interventions. You've got kids that are responding really well to the intervention and the structure, and they're learning really quickly. And then you have a percentage of kids who will probably need support. And then you have another percentage of kids who are going to need long-term
Hmm.
support,
Is
if
this in
not,
the works, this project in the work? Like it's going to become a,
well, it is. It's in the
okay,
works, but I mean, of course, part of part of it is just the funding
of course.
to go, so I'm trying to kind of piecemeal it together because,
That's
it's
exciting.
not really, people, a lot of the institutions that provide funding, they want a new intervention. They want the new thing, that's what they're funding, or they want something very specific, like I'm going to improve X, Y, and Z with this intervention. So
Versus,
looking at programs like that, we've kind of gotten away from that. And I think there's benefit to that. I think we kind of know, like, okay,
yeah.
there's not one program. There was the study that, who was the first author on it? Sally Rogers was the first author on where they did a comparison between NDBI and more traditional
Right.
ABA, and they found really no differences.
Yeah.
They both work, they
Yeah,
both
I
work, and
was
they're
so
going to work
excited.
differently for different kids, and so so I think there's um, but early intervention matters, and getting some, learning important skills matters, I think, for that trajectory. So I'm hoping that we'll get some funding, and if not, kind of piecemealing things together just to go back and, follow up with these kids. So
Well, that'll be a really important
families.
space to watch for that. I'm going to make sure I link everything that we've talked about and some of the notes, like the DEC
Mhm.
practice guidelines, I think would be great to
Yes.
link the early
Good. And
funding.
that's Division for Early Childhood. So just to know, that's the acronym, and it's a chapter of the Council for Exceptional Children.
See. Yep.
So,
Got
which
it.
is the big the big professional organization for people who work with
Yes,
children
that is
and
my
youth with
goal.
disabilities.
Yeah.
Yeah.
My goal
So
is
yes.
to hit those
Hmm.
conferences, to get
Hmm.
outside the ABA conference track and to go
Hmm.
to
Hmm.
those kind of
Yeah.
conferences, which I have never attended, or submit a
Hmm.
presentation just to go
Hmm.
there and see what they're saying. And just,
Yeah.
I feel like NDBI is going to be all
Hmm.
over there. Like, oh, you might not call it that, but that's
Right. No,
that,
absolutely.
right?
Yeah. I
Yeah.
mean, I think a lot of the people I mentioned before have presented studies they've done over the years, and, so, but
Yeah.
it's all, the basis of their work is, I would say, and,
Yes.
NDBI related interventions. So,
Yeah. The values just track
hmm.
all the way
Hmm.
across them. Oh my gosh,
Yeah.
I love it. Any recommended resources or how you stay up to date or where you find information about
Yeah, well, I mean,
NDBI?
conferences I think are a great, if you have the ability to attend conferences, there's obviously a financial piece to that. But conferences, staying connected to colleagues that are in the field. And so I have, I try to be members of working groups if I have that opportunity. And then, it's hard to keep up on the literature. It's like a constant, um, a
Yes,
constant struggle.
the alert.
But I think, yeah, I think that, some of that happens by just being, in contact with
Yeah.
other people in the field, and they can, make recommendations, and then I have my favorite people that I follow, so so
Ah.
that's always good. Um, oops,
Did you
sorry.
mention books? Did you have a few books that you mentioned?
Well, my
You,
computer is going to restart. I hope it doesn't start. Okay. Well, one that I really like is, you can see I like it because I got all these. So this is
classroom PhD.
classroom pivotal response,
Yep.
teaching, which is Aubin Stommer's the first author on that. And of course, it's, based on, PRT
Yep.
principles and practices. So I think a reason I like that, because again, you read Early Start Denver model, similar things in there, but I think they did a really nice job of simplifying complex topics, and in a way that's easily digestible, I think, to people that
Yep.
don't have a lot of experience in this area. Oh,
Yep.
shoot. Are you there?
Yep. We're still here.
Okay. I
Yeah.
was like, oh no, I thought I restarted you, but
That's
no.
okay.
Um, so anyway, that's
Okay.
one. Of course, Project Data. I really,
Yep. I'll link
that's the
that.
kind of, yeah, the Eileen Schwartz is the first author on that. And there's a manual for that. The LEAP model, which there's not as much,
Also,
people don't
yeah.
talk a lot about that anymore, but when I was,
When I lived in
that was one of the
Denver.
first.
Yep.
Yeah.
Yeah.
So,
That's so strange
Um,
work. I'll see if I can find a
yeah,
website for
Phil
that.
Strain. Yeah.
Yeah,
Hmm.
yeah. When I lived in Denver, I got to take a tour
Hmm.
of one of the classroom sites. It was so
Hmm.
cool, and I think I got a manual. Probably
Yep.
still have it in a binder somewhere in a drawer. But it's hard to
Exactly.
find stuff. But that's
Hmm.
another great
Hmm.
one. Yeah, learning and
Yeah.
resilience autism program. What's the acronym?
Yeah, of course, I can't remember what the acronym is, but
Learning
LEAP is.
enrichment. Yeah, we'll link it. But yeah, I know
Yes.
what you're talking about.
Yeah.
Yeah, that's a good one.
But that's a great, I mean, obviously that's a great model. ESDM, uh, Amy Weatherby has done a lot of really great work. So the CERTS model, which
Yeah.
again, these people think these are when the feedback I get, and that's true about project data too, like this is overwhelming, this manual
It's a
to
big
your
one.
general practitioner, like they're
Yeah.
like, I don't even know where to start. Another book that I recommend a lot, it's not autism specific, but it's called Building Blocks, and
Oh, I
Susan
have that.
Sandall
Yep.
and Eileen Schwartz are the authors. And, Susan Sandal, obviously, she was a mentor of mine too and had a lot of
Oh.
influence on me. But that book, it really gives you practical ideas like how do you set up your classroom and how do you plan to do instruction across the day. So it's pretty it's got some nice practical
Love it.
um, strategies in
I
there.
didn't
So
even think
those are
of
some of the
that.
places I go for, or the things I recommend when I'm working with new teachers or school
Yeah.
districts or whoever. So,
Oh my God. I got a cramp in my hand from all the notes I've been writing about all these resources and all of this
so
amazing content you've been sharing. Oh my God.
well, thanks. It's fun. It's been fun to talk with you about all of these things. So
Can't wait for everyone to listen
appreciate
and
it.
to learn. Yes, I appreciate your time
Hmm.
and your expertise and the depth of your knowledge in all things related to community practice,
Hmm.
access, early inclusive settings. That's such an
Hmm.
incredible avenue, I think, for us practitioners that are working in clinic-based models to really broaden their
Hmm.
horizon and think about
Hmm.
how do we not infiltrate, but kind of integrate within community
Hmm.
settings, or what bridges can we make to help transition
Hmm.
kiddos out into an environment that can
Yeah.
really successfully support them. And I
Hmm.
think you're doing some really incredible, groundbreaking work as a
Hmm.
model to say it can
Hmm.
be done, and here's how we can kind of reverse engineer what does a
Hmm.
child need to know to be successful in this setting, and think
Hmm.
about that when you're programming in your clinic, to think about that bridge
Hmm.
or path or journey or whatever you
Right.
want to call it, and
Hmm.
that back and forth. I
Hmm.
think that's really, really
Hmm.
innovative, what you guys
Yeah.
are
Well, I mean, I think it's really goes back to the principles of AB, that
doing.
Don Bear and
Yes.
folks, identify like, socially important behaviors are those behaviors that you need to use in the environments that you're in. So I think it's just it's always good to kind of go back and look at your roots and say, am I practicing in this way, so that we don't forget, what the intentions of ABA were initially.
Yeah.
So
Some wise sage
it
words.
wasn't a it wasn't a individual practice. It's a science of behavior. So, yeah. So
Oh,
remembering that's important.
yeah, such good words of wisdom to end on. Well, this has been
Right.
incredible. Thank you so
Well,
much.
thank you for inviting me and appreciate it.
It's been wonderful.